Now, here's something you don't hear every day. Patients have actually been missing going to see the dentist. Well, we are now well and truly open.
As you've probably seen in the news recently, NHS dental practices are due to reopen to see patients on Monday, the 8th of June. Well, in reality, this may or may not happen for a large number of surgeries. A lot of the articles you might have seen reported the majority of NHS practices will, in fact, not be opening for business next week. This is partly due to a lack of all the additional PPE needed to comply with all the new regulations, and also the need to train staff for all the new protocols.
We are already open to see patients for routine treatment. Along with a large number of private practices, we've been fully prepared and ready to see patients in a safe, secure and fully compliant way for some time now.
The gold standard protocols were released some time ago, and although they have been eased somewhat, we were able, through some pretty tireless phone calling and badgering of our suppliers, to obtain the PPE required. Essentially, the PPE that patients are going to notice most of all are different types of masks, long sleeve gowns, face shields, and a huge glass screen for reception.
But hopefully, as the restrictions are eased over time, these extra precautions will also be relaxed. So, having ticked all the boxes and jumped through all the required hoops, we are now back.
However, we're not back as you know it. Things will be a bit different for a while in terms of social distancing, of course, which will limit the number of patients we can see in a new normal day. To see how things are going to be different, click on the link below for a guide as to what to expect.
Obviously, we've got quite a backlog of patients needing some quite urgent care, and a similar number who were midway through treatment when we were told to close back in March. As you can imagine, these patients will be a priority, but it won't be too long before we can start seeing you all for your routine checkups and regular hygienist visits again. Although it may be that we can't schedule these appointments together for some time, and as such we may have to ask you to attend for each treatment at a separate visit.
In the coming days, we'll be on the phone or sending out emails, initially to clear our most urgent cases, but then to everybody who had to miss appointments after lockdown was imposed. Please feel free to call us if you'd like to arrange an appointment. So, thank you very much indeed.
Thank you.
Thank you.